In this video, I'll talk about the treatment for vertigo. This was a 68-year-old female patient, and she had a diagnosis of positional vertigo. She suffered with it for several years. There were times of crisis where she had to go to the emergency room because she couldn't even stand up. The doctors would do the manipulation to relocate the crystals. She would feel a bit better. She was on medication also, but she was never okay. When I went to see the patient, she had been suffering with it for about 2 years now. And even when she was on the good times, so not in a crisis, she couldn't walk on a straight line without holding on to something. And even if holding to something, if she turned her head quickly, she would feel dizziness and most of the times fall. Even though I mainly use the balance method, I use the diagnosis from classical TCM also to combine it with the treatments I do, especially when treating internal medicine and something other than pain. So for this case, I took the patient's pulse, I saw her tongue, everything of the regular diagnosis, and I diagnosed her with a kidney yin deficiency. And what would happen is the yin wouldn't be sufficient to hold in the yang, so we'd have uprising yang, which would originate the vertigo. So I determined that the main affected channel was the kidney. I also saw some signs of weakness in her heart, so I decided to do a balance using Yin and Yang. So the channels used were small intestine, heart, bladder, and kidney, of course. And the points I chose were all images of the head and particularly the ear. So I did heart 8 and an ashi point around R3, small intestine 3 and ashi around small intestine 8. In the legs I used ashi points around kidney 10 and kidney 5, and the same for bladder 40 and bladder 65. So I was using the regular image, using the hand to represent the head, and also I was using the big image representing the full head on an arm or on a leg, and going for the area of the ear. Along with these points, I also added on the small intestine side Sancha Sun. This is a master tongue point that will at the same time treat small intestine, triple warmer and heart, and it will nurture the kidney. I also added Yamamoto New Scalp Acupuncture, which is one of my main weapons when treating vertigo, and the point I used was the 8th cranial nerve, which is the vestibulocochlear nerve. This nerve is important to regulate balance, and I used it bilaterally. After the first treatment, the patient was already feeling better. As soon as we took off the needles, she could walk better without holding on to stuff. We kept on the treatment for 7 weeks, 1 treatment a week, and by the end of the treatment the patient could walk without holding on to anything. She wouldn't feel any kind of dizziness, she could turn her head, she could even walk with her eyes closed without feeling dizziness. So we stopped the treatment and the patient was okay for over a year. She called me about 14-15 months later. She felt the vertigo starting to come back, so we did 3 more treatments and it went away again. Vertigo is something that I know is sometimes very hard to treat with TCM. In my experience, the combination between balance method and Yamamoto New Scalp Acupuncture is almost magical, and it will solve or at least largely improve most of the cases. In this case, we were able to help this lady to regain a lot of quality of life because it was very hard for her. She had to have someone to go with her every time she left the house. She was afraid of walking, and now she leads a perfectly normal life with absolutely no symptoms. The doctors couldn't help her. She improved a little bit with the medication she was on, but she was still suffering a lot from dizziness. Fortunately, I could help her with acupuncture and restore her quality of life. If you like this kind of content, don't forget to like and subscribe to the channel. Also, if you want to learn more about the balance method, I have a course available which you can check out on the description of the video. For now, the course is Portuguese only, but I will soon have an English version to offer as well.